So my name's Julie Rish, and I work at the Cleveland Clinic and the Office of Patient Experience, and I wear a few hats for the clinic. So one part, I'm a clinical psychologist. So I've spent most of my professional career helping people with health behavior change. And that blends nicely to the work that I do in patient experience, because it is about how do we change and adapt our behaviors to best support our mission and cause in the organization and come together. I also direct communication skills training for our medical school. So I am active in teaching our students what communication with patients and each other could look like and potentially should look like, and bringing in that next generation into healthcare. And then most of my life is in patient experience. So and really leading efforts, one, in how do we partner with patients, their family, and their support persons to really improve care and to reimagine what that partnership looks like so that we can be very strategic to maximize that full potential of partnership and to manage the complexities of healthcare together as a community. The other part of my life is complementary, is applying design thinking to our work. So in a variety of settings and in really great collaborations across the Cleveland Clinic. So how do we do that in a way that brings together all the stakeholders to design something better for our patients and for our people? I think medicine is inherently human. The art of medicine without relationships, we're not just technicians. And providing excellent patient experience is about meeting people in a very relational human way. And so I think that you can't disconnect those two things. Optimal healing can occur without the humanity of medicine, without a true understanding of another person sitting in front of you, without being able to empathize with their experience. Relationships are healing in and of themselves. And so when we're connecting as people, it's healing to me as a clinician, but it's also healing to the person that's sitting in front of me, above and beyond what we can do medically for someone. I agree with you. I think that what we've done so beautifully is really put some stake in that we are going to care about our patients and we're going to care about our people. And we're going to invest a lot of energy in both. And trying to understand one another, trying to appreciate each other's perspectives, see things through different lenses, and design it together. And I think that that's a beautiful model that will help us improve as a system, but also help us improve and transform healthcare. There's a lot of barriers to being human in medicine, and I think we know about that. It's widely publicized, but burnout in our clinicians and just the detrimental effect that has on them individually, but also on patient care. So it's double-edged in that, and it's complex to solve. The burden of documentation and providers spending more time in documentation than they are in front of the patient, and trying to find meaning and purpose in their work, and the complexity of trying to solve that. The knowledge and the explosion of that is another barrier in some ways, that trying to stay current when there's so much information is hard, right? How many hours a day can you possibly invest, and then how are you finding balance in your life and spending time outside of the walls of the system that you work? There's a lot of barriers that equal time and task pressure, right? That how can I be present in this moment, and not thinking 3 steps ahead or 3 steps behind, but just to be present in the moment. When you do that, you can find meaning and purpose in your work. The barrier is, how do we overcome those obstacles to create moments of presence, and being mindful and truly connecting on a human level, because that's where we can find restoration and purpose and get back to why you chose this profession, this career, this entity in the first place. That's our greatest opportunity right now, is to try to navigate those barriers in a way that is optimizing the human connection. The importance is clear that, right, I talked about that relationships are healing, and it's hard to create a relationship without being present and authentically yourself. And if you're struggling with burnout and it's easy to depersonalize a situation and to create some distance between you and the person sitting in front of you, it's also hard to create, right, the meaningful moments that equal satisfaction with your career, with your experience in that moment, and with the quality of care. Navigating the system in a way that we are creating that is our greatest imperative. We have to think bigger than clinicians. We absolutely have to continue to invest in our people. That's clinicians, but I think that's other members of our clinical teams and our staff in a healthcare system that we see burnout in many different places. And so being thoughtful about what we're and how we're investing in our people is really important. And I think to think bigger than just the people, that it's systemic, right? If we're asking people to spend half of their day in documentation and in the evenings and all hours of the night, then how can we possibly expect them to overcome these barriers? Thinking systemically, what does healthcare need to do to better support our clinicians, right? So the burden of documentation and policy and the pressures that we're placing on top of them, while also, right, kind of how do we change the top down, but also how do we support from the bottom up? But also equipping people with the skills to communicate effectively, to connect to meaning and purpose in their clinical encounters. And in some ways that's by just teaching someone how to listen and to empathize with someone else's experience and perspective, and connect to that as a human. And again, I would transcend more than just our clinicians. I think it is our nurses. I think it's the other people that are touching our patients, from the person that checks you in to the person that you speak to on the phone when you're trying to navigate and make an appointment, to the information that you get when you leave the hospital. There's so many different touch points that we have to connect to. These types of solutions have to be co-designed. Oftentimes it feels like we are pushing solutions out, and those solutions need to be brought together from the people most intimately affected. So our patients, our people, our clinical staff, our non-clinical staff, but those people need to come together to define what that solution looks like and what the need is. Oftentimes I feel like we're just kind of creating solutions, or, hey, great, let's give you some communication training. But is that the training that you need, and is that what's going to solve the problem? And is this actually the problem to solve, or the opportunity to innovate around? I think if we are not talking to those people most intimately affected at the beginning and throughout, I'm not certain that our solutions are going to work, and that we're actually going to be transformational. I think the future of patient experience relies on meaningful partnerships and collaborations, intimately integrating our patients, their family and support persons into our work, and having them help us co-design care from the beginning and from all phases and all levels of the organization. If we're not doing that we run the risk that we're not actually providing the care, the needs, the solutions that our patients really need. Bringing them in and sharing that space with them in true partnership, not in a focus group setting, but true partnership where we are identifying the problems, to working alongside, to creating solutions together and testing them out. Patient experience relies on our willingness and openness to do that together. The future of patient experience relies on meaningful, strategic, maybe relationships with each other, where we're talking together, where we're coming together to solve these problems. I would suggest that technology needs to be seamless, and that it affects both our patients and our clinicians, right? So it needs to solve for tremendous burden of documentation and the non-face-to-face time that our clinicians are struggling with, and that it needs to facilitate making healthcare more simple for our patients. If you think about what exists right now, there are thousands of apps and thousands of different platforms that someone could go to. And how do you know what's the right app to download, or how to even find the right app for the problem that you're trying to solve? We in healthcare need to streamline those applications in a way that's meaningful to our patients, right? That's going to help them navigate the system and connect them in seamless ways. And I would say the same for our clinicians, that technology needs to create the moments of connection, the human moments, and to take take the burden out of some of the non-human moments for a clinician. So it needs to really solve for both ends of that spectrum to simplify the experience of healthcare, because I think otherwise you need an app to navigate the apps. The most important thing is being willing to be vulnerable and humble, and to learn from each other, to be thoughtful about how we partner with the people around us, and how we learn from each other. And all of that takes like deep understanding and empathy, and really trying to appreciate someone else's experience and perspective. Because if we're not doing that, we're not actually solving at that intersect. And that's where we really need to be, is, what are the solutions that make the most sense for the most people at the right time? And to me, that's transformational, right? So we could set up really great population health efforts, but if it's not the practice or the services or the values of the community that it serves, then what have we done? So I think really being thoughtful to first understand the people that are out there, really empathize with that, and then solve those problems together and create those opportunities together. That's what's exciting about healthcare, is the great potential of what you can do together and in collaboration. So
Thank you.
Excited to be a part of it.